Chatham House and the Graduate Institute in Geneva have teamed up on the African Public Health Leaders Fellowship to strengthen public health across Africa. This is a 12-month programme that fellows do most of the work while still doing their day jobs in their home countries.
I've been at the African Union for close to 7 years now, and I've had opportunity to engage at the very highest level. But of course, there's always an opportunity to improve on whatever you are doing. So I felt this is an opportunity for me to improve on my leadership and the governance skill as far as public health is concerned on the continent of Africa.
One of the things I've realized is that I have the real power to influence decisions in my country. I think for me that's a big thing. It's not about what other people can do, but what I can do and I have the capacity to do. So I think that's one of the big things that I have learned.
The men throughout the world, they're actually, they've done their bit. And I think they've taken the world from A to B, but we need more leaders because we have found that when she leads, actually a lot of things happen.
We would like to welcome you to Geneva, the global health capital of the world. It is here where global health leaders meet and shape policies. And we want to enable you to meet those leaders here in Geneva, be it from the WHO, the World Health Organization, Gavi. There are many more organizations, of course, which are impacting on health. All of these organizations are based here.
So I do believe that this fellowship stands for a unique opportunity enabling us to see public health issues and global health issues through a different lens, to strengthen our leadership capabilities and to broaden our perspective towards global health related issues.
Candidates must be in Africa, in a fully paid position in public health that allows them a month's absence for the foundation course and some time for the fellowship during the 12 months. Fellows graduate with more knowledge, insights and skills to develop and implement public health policy, an expanded network and the ability to grow further, and of course strengthen leadership skills.
Some of the learnings that I think in the past I have taken for granted, and certainly that gives me a niche ahead, and I see myself in the coming months getting better and better because this fellowship has offered me the opportunity, a whole pool of experts who I can leverage and ask questions.
And it has been quite helpful having the broad overview of the public health system globally and also in this country. I liked the structure of it, the fact that I wouldn't be away from my job for so long. I think that this particular fellowship has really opened up many more views, many more opportunities, I think.
The fellowship begins with a brief foundation course with time spent in London and Geneva. Fellows get coaching and mentorship from professionals who have worked at the highest levels of national and international public health policy and global health diplomacy. This intensive orientation and high-level mentoring are hallmarks of the programme, providing fellows with a unique platform to become future leaders of public health.
Inherently, I've always thought that I had some leadership traits, but perhaps I didn't. So I felt that in whatever space I found myself in, that I would sort of try to lead, not just drive things, but be a leader in those spaces. But to think of it in terms of coming out to the front and really driving a public health agenda, I think that's my lens has really changed on that. And for me now, I see a potential for me to be in that space and be able to move this forward as my career progresses.
If you see yourself as one of the next generation of public health leaders in Africa, do consider applying.